17th. And so that's a continuation of the trend that we're seeing in our hospitals with less individuals, fewer individuals with COVID-19 who are being placed onto ventilators, or in addition to that, people coming off of ventilators sooner than they otherwise would have. Again, all the numbers that we've been talking about have just happened over the last month. And I know sometimes when I think about it, it seems like we've been in this fight for 6 months or so, but it's really been just one. Right now, we continue to see continued signs that we are leveling off in the cases. Obviously, the deaths remain much higher than we would like to see. But it remains the case that we are seeing signs that we're starting to flatten the curve. We can't say that it's truly flattened yet, but every day over the past 3 or 4, we've seen those indications, and it appears to us that the mitigation measures in place, the stay-at-home order, the social distancing, the hygiene practices are starting to pay off, and we're seeing that in the numbers. And I caution everyone to understand that the numbers will continue to trend in a favorable direction only so long as the state of Louisiana continues to comply with the stay-at-home order, the social distancing, and the hygiene practices that we've been talking about. And you've all seen improved modeling at the national level, and we're seeing those here in the state of Louisiana as well. All of those models are premised upon the assumption that the mitigation measures stay in place, precisely that the stay-at-home order stays in place, that people comply with those, that only essential workers are working, that other individuals only go out when it's essential that they do so, and not more frequently than is necessary, and so forth. So that's incredibly important for people to know. We continue to owe all of our healthcare workers and first responders a tremendous debt of gratitude, one that is just tremendous. They're doing life-saving work. Tonight, there will be a collective salute to the millions of essential workers on the front lines of the COVID-19 pandemic. This will be taking place across the country tonight at 8 p.m. Local time. And across the country, there'll be 150 iconic landmark buildings that will become beacons of blue to simply say thank you for all that these individuals are doing. And so this is part of the Light It Blue campaign that extends from One World Trade Center in Madison Square Garden in New York to right here in Louisiana. And in our state, the participating buildings will include the Superdome, the state capitol, the governor's mansion, LSU's Tiger Stadium, Southern University's F.G. Clark Activity Center, and Louisiana Tech is also lighting its iconic fountain tonight, the Lady of the Mist. We encourage everyone to join in, and if you can't light it up blue, do what you can to show our medical heroes and first responders, who are also heroes, how much we collectively support and appreciate them. I also want to thank a number of individuals and entities for the outpouring of generosity that has happened over the past few weeks from both the public and private sectors. It has been truly remarkable. Today I'm announcing 3 additional donations from companies to help us here in Louisiana. Salesforce will donate 500,000 N95 masks, 100,000 gloves, and 50,000 shoe covers to our state. Walmart has announced that they will donate 25,000 N95 masks, and Shell, right there at Norco, will donate 10,000 95 masks. We appreciate all of them, and we know that these items of PPE will go a long way to helping our frontline healthcare workers. I'd also like to again thank Walmart for partnering with us on bringing more testing to areas of the state where it has been lagging, principally up in Shreveport and down in St. John the Baptist Parish as well. I'm also pleased to announce that we've approved the first grant from the COVID-19 Response Fund. You may remember that the Baton Rouge Area Foundation, the Huey and Angelina Wilson Foundation, and the Irene W. and C.B. Pennington Foundation each contributed $400,000 This fund is being administered by BRAF here in Baton Rouge, and it's specifically for the Baton Rouge area, and they created this COVID-19 response fund. More than $100,000 of that will be given to the 3 O'Clock Project, which has expanded its meal distribution services after some public school systems were no longer able to continue their cafeteria services. And with these funds, they will be able to reach 30,000 more kids daily. The nonprofit is serving free meals to children under 18 in East Baton Rouge, St. Landry, Assumption, Iberville, and Ascension parishes, as well as other parishes across the state. A consortium of more than 60 restaurants is preparing thousands of meals daily, retaining restaurant workers who otherwise would have been unemployed because of the coronavirus outbreak. I also want you to know that while we can't host the annual Easter egg hunt at the governor's mansion this year, we had already gotten all of the candy necessary to have that, and most of it from Elmer's there in Ponchatoula, and we've donated that candy to local food banks in East Baton Rouge Parish schools for the children and their families to enjoy. I know right now, as we are celebrating and marking Holy Thursday and approaching Easter weekend, it's a little hard to feel connected to each other. And so I wanted to share that the Nextdoor app is up and running. It's one of the largest sites for neighborhoods in the country. We're going to be sharing updates via Nextdoor. And we also want to be, we'll be working to get neighborhood captains organized to help support local businesses. They can place orders from restaurants and so forth, and the captains can then pick up the orders for everyone at once and help reduce the number of people having to go out and make contact with other individuals. So that is the Nextdoor app. This is part of Louisiana's Get It To Go campaign, which features a public service announcement by LSU gymnastics coach Dee Dee Bro. We know our local restaurants are working hard to help feed people, and we want everyone to know that when it comes to our Louisiana food, you can get it to go. As I mentioned, today is Holy Thursday, tomorrow is Good Friday, and of course Sunday is Easter Sunday. The Easter story is, at least in part, a story of waiting for new birth, and we're in another period of waiting right now. One that's unfortunately going to last past this coming Sunday. But there is light at the end of all this darkness. And I did want to encourage the people of Louisiana to look at it in that fashion. I encourage them to continue to comply with all the orders that are in place and to be patient and to be resolute. Because if they will do that, then the light comes sooner, and the sooner we can start transitioning back to some sense of normalcy. I do want to extend my prayers and condolences to the family of Pastor Harry Blake of Shreveport, who passed away last night. He was 85 years old and an iconic leader of the civil rights movement. Pastor Blake served the Mount Canaan Baptist Church for more than 52 years. He endured many hardships during his life, and in fact, very nearly lost his life during the civil rights movement. But he never wavered in his faith, nor in his work towards equality and justice for all people. This state will be forever grateful to Pastor Blake and for all that he did, the sacrifices that he made to make our state better. And we certainly remembering his family, and we will keep them in our prayers. Before I get to questions, I did want to follow up with a question that Greg Hilburn asked yesterday, and I didn't have the answer to it, and that is whether the $600 per week payments are retroactive. This enhanced unemployment benefit that will go not just to those who are traditional employees and can benefit, but in this case, because of the CARES Act, this money will also be made available to individuals who are 1099 workers, self-employed, gig workers, and so forth. Those payments are retroactive, but only to the week that ended on April the 4th. So this is the second week. I've directed Secretary Ava Dashwa to begin making those payments on Monday of next week. So, Greg, the answer to your question is yes, retroactive to the end of last week. So that will start next week. And again, those payments are in addition to the normal state benefit, which maxes out at $247 per week. So I will now take a couple of questions that came to us from the public. First, Joy asks, I have recently been diagnosed with breast cancer and am in need of surgery. Surgeries are on hold right now. Is there any way of knowing or anticipating when these much-needed surgeries and related procedures will be able to be resumed? First of all, I'm sorry about the diagnosis, and Don and I will certainly keep Joy in our prayers. But if your doctor deems that surgery necessary, there is nothing in the order that came from the Department of Health that prevents that surgery from being scheduled and conducted. And so I encourage Joy to go back to her doctor and inquire about this. The second question comes from Dave. He asks, what are you doing for first responders, especially those working with EMS and must go into these unknown situations to complete first-line treatments? First of all, as I mentioned earlier today and numerous times, we are very thankful to all of our first responders, all of whom show up in a big way every day across the state of Louisiana, but especially during times of disaster and emergency, whether it's a natural disaster or this public health emergency. And I want to say that on behalf of the state of Louisiana, we really appreciate all of our first responders. And we know that they're on the front lines of the battle against COVID-19. First responders, first of all, we encourage them to use PPE, and we're furnishing PPE as best we can to all of the parishes in the state of Louisiana as we can, consistent with their request. In fact, we have distributed PPE to all 64 parishes. We're also sending that PPE to hospitals and nursing homes and so forth. And when we make testing available, priority is being given to first responders who are symptomatic, because we do want them to know just as soon as possible whether they have COVID-19. And we're going to continue to do what we can to support our first responders across the state of Louisiana. One closing note, tomorrow our press conference is going to be earlier as we are going to do things a little differently for Good Friday. So we will have this press conference at 1 p.m. So with that, I am prepared to take your questions, and we do have Dr. Alex Bu here for questions related to testing. Yes, ma'am.
Governor, the school superintendents and Bessie's leadership have sent letters asking for you to keep K-12 school facilities closed through the remainder of the year. Have you made a decision on whether or not you intend to do that?
Melinda, the letters came in literally just minutes before I came out, and I have them from the Board of Elementary and Secondary Education, the Department of Education, school superintendents, and the School Board Association. And I anticipated getting the request. I told Beth Ciano, the interim superintendent of education, this morning that I would have a conversation with her after I received a request from them. I haven't had that conversation, but I'll have it today. And I just want to make sure that I'm clear on what they're requesting and some other things, and I'll be making an announcement. And it's going to happen relatively soon, and obviously there's a really good chance that I'm going to quickly do what they're asking me to do, and so I'm not trying to keep people in suspense. I suspect that order is forthcoming very quickly. Yes, sir.
Attorney General Landry said through the request of your health department, he's formed a task force to make sure clinics are not performing elective surgery. He sent investigators out this afternoon to 2 abortion clinics in Shreveport and in Baton Rouge. What can you tell us about that initiative?
Well, we've received complaints over the last couple of weeks about clinics of various types all over the state of Louisiana. Not necessarily a huge number of clinics, but in different geographic regions. Some of them dental clinics, some are colonoscopy, and others have to do with vision. And we certainly received some as it relates to abortion clinics. And so we are trying to ascertain now whether any of these clinics are in violation of the orders that have been issued by the Department of Health that stopped non-emergency medical procedures in order to try to conserve PPE that could be used in the fight against COVID. Those investigations have started. I haven't received the result of any investigation in any one of those clinics, and so I don't have any more to add at this point, but I'm sure that there will be additional information at some point.
Do you believe that abortions are an elective procedure?
Well, I think it would depend on the conditions under which one was performed. And again, we're gonna have more information about this soon, and we'll share it with you when we get it. But I have not received the results of any of those investigations yet.
So to be clear, Jeff Landry is investigating these abortion clinics on behalf of your health department, and you're going to decide what to do once you get the.
Well, I believe there is an effort with the State Board of Medical Examiners, the Department of Health, and the AG's office to try to figure out whether clinics are violating the order that was issued several weeks ago by the Department of Health.
Do we know which of the 3 abortion clinics in Louisiana are performing the procedure right now?
I don't know. You know the questions? Yes, sir.
The CDC has started to do blood testing for coronavirus antibodies across the country. Do you support the use of this type of testing in Louisiana? Would you like to see the CDC do something similar
The
here?
serology testing?
Is
Yeah.
a way to inform
Yeah.
when we reopen? That sort of thing?
Yeah, well, first of all, it's critically important to know that. And as we transition at some point in the future, as we're able to do so, and start easing up on the restrictions, which we are not doing today. I'm not announcing that today. It's totally inappropriate at this point. We know we have a ways to go while we need everyone to continue to comply with the stay-at-home order, with the social distancing, with all the hygiene practices. But as we do, when the circumstances allow us to start to transition, we know that more testing of all types is going to be required, whether it's diagnostic testing, surveillance testing, or this serology testing, because we would want to know, for example, if someone contracted the disease, developed antibodies to it, and then have immunity potentially from getting the disease again. And by the way, we still have to know, because this is a novel coronavirus, exactly what that means in the context of this particular coronavirus that we're up against. Because we don't know that it doesn't come back in the fall, slightly different, mutated. You know, every year you got to get a new flu vaccine, and it doesn't matter whether you had the vaccine last year or not, or whether you had the flu and developed antibodies. It changes over time. But knowing whether there are antibodies in an individual and the immunity that confers upon that individual is important, and knowing just how free that individual then is to resume work, and to going out in public and making contact with people. So we're going to be looking to avail ourselves of that testing as broadly as we possibly can once it becomes available, especially in the context of that transition that I talked about. But we're also going to have more testing as it relates to surveillance and diagnostic, the kind of testing we're doing now. Hopefully more of the quick turnaround time, the 15-minute type testing that we're starting to see come online now, so that we can do more contact tracing and isolation of those with respect to those individuals who are positive, because that just becomes more important. I think what we all should recognize that if this plays out as we're beginning to expect that it will over the next weeks and months, a very high percentage of people in the country and in Louisiana will not have been exposed to the virus, and so that means that they remain susceptible to it, and especially as it relates to our most vulnerable individuals, those who are 65 or older and those who have these chronic underlying health conditions. We really need to be able to protect them to the maximum degree possible, and only testing will allow us to do that, the testing of all 3 types. And I continue to share Dr. B's feelings on this. We wish we had more testing. But I will tell you that we still have either the number 1 or number 2 amount of testing in the country on a per capita basis, which means we have really done all that we could to make available all of the testing that was possible in the state of Louisiana, and we're going to continue to do that as we go forward, and it relates to the types of testing that you just
So
talked
we
about
don't
as well.
have the ability to do blood testing for antibodies now, but you hope to get that through, what, the CDC in the coming weeks, or the timeline?
Yeah, so we don't currently have a serology test for the antibodies in blood. We are working with labs across the state to test some of those tests. Unfortunately, we don't have the same system. Maybe fortunately, we don't have the same system for vetting those tests that we usually relied on, where the FDA would put a test through long periods of rigorous testing before we would be able to use it. The FDA has given guidance to states to be able to do independent testing locally so that we can then determine which of these tests are going to perform well enough that we feel confident in their results. And we've got partnerships around the state that are going to begin looking at these various tests, and when we feel like there's one that's reliable enough to deploy, we will. The CDC has developed their own test and will be doing these tests using their own tests. And that may be something that we also have access to, just like the PCR test, the viral test that we do in our state lab, part of which was developed by the CDC. We now have another machine that does that test using a different setup, but both of them testing for the virus itself.
And this is related. It's not really an answer to the question that you just gave us, but I was paying attention to one of the news stations a few minutes ago before we came out, and they were talking about patients receiving convalescent plasma transfusions. It's a similar concept. You take plasma from an individual who's developed the antibodies because they've recovered from the disease, and then you use that plasma to treat other individuals who are still fighting the disease. And I will tell you that that's just now starting to happen across the country. It is happening in Louisiana as well. And so we really are on the front end of all of the medical science related to the response to COVID-19. And I say that just because I really appreciate the work that's being put in by the medical community here in Louisiana. Yes, ma'am.
Governor, obviously, we learned overnight that FEMA and HHS are saying that the national stockpile has been depleted, and there is nothing to give states right now in terms of PPE, ventilators, those kind of things. Did you get any notification, or did the governors get any notification in general that was happening? And do you have any concerns about that? Does that change how you're approaching trying to obtain things like PPE and ventilators?
It doesn't necessarily change our approach, but it does change our what we anticipate will happen, what our expectations are. We've been told for a number of days now that the federal government and the coronavirus task force being led by the vice president, but the response is really being headquartered at FEMA. They've all been telling us not to expect to continue to receive large amounts of PPE from the national stockpile. Instead, the states and the medical providers should be trying to source PPE from the traditional distributors and vendors. And in order to facilitate that the effort nationally would be to acquire PPE from all over the world through an air bridge, and that flights would be coming into the United States literally on a daily basis, and then making that PPE available to the distributors so that we and our medical providers could source those materials. So, I will tell you, we've had longer time now with the air bridge in place. It appears that the PPE is becoming more readily available. I'm not going to say that we have as much as we would like and that it always comes in as soon as we would like it. But it seems like we're moving in a better direction in that regard. So I'm not especially troubled by what we're hearing with respect to the national stockpile. And I'm not surprised by that either, because they've been telling us to sort of wean ourselves off of the national stockpile and move in this other direction. And as I mentioned, we're now starting to get much more support from the private sector via donations as well. I mean, 500,000 masks from one donation, and these are N95 masks. These are the masks that are most sought after right now. So we're in a little better place there. I'm not going to say that we're out of the woods. PPE remains a concern. Not just for Louisiana, but for all the states in our country, and for probably 160 or so countries across globe.
On that subject, several states have sort of talked about getting together to use their purchasing power together. Are you in any conversations with other states to do that?
We are not. We're looking at the concept to see whether it confers any advantages. Right now, quite frankly, we don't see it, and this still in the early stages of developing these consortiums, and whether that really, through the enhanced purchasing power that a consortium might have relative to the states acting individually. I just don't know that confers any benefit, and it may add an additional layer of sort of a bureaucracy that you have to go through in order to place an order for and then receive your allocation of PPE. But we are taking a look at it. We haven't said no, but it's something I've asked Colonel Wascom to take a look at and see whether that's a step he would recommend. And then we're also trying to talk directly to the states that are doing it to see whether they believe it's going to be an improvement. Yes, sir.
Governor, on the subject of schools and the decision on that, a lot of them are doing learn from home through Zoom, FaceTime, things like that. Is that an effective method of educating, and is it desirable?
Well, it's probably the most effective method that you have when you are not able to assemble in your classroom. And so because of that, and because we want our children to continue learning as best as possible and as much as possible, it's desirable because the only option is to do nothing. Now, it's not a very good fit for career-oriented classes and so forth, but obviously it is much better than a young person who needs to be in school not doing anything related to learning. And by the way, schools are also across the state of Louisiana, they continue to try to get traditional materials in the hands of children too, paper as well. But Zoom is one of those options. You know, I had my first Zoom experience just over a week ago, and while it wasn't like being in the same room with all of my siblings and my mother, it wasn't bad either. And it allowed us to be connected and to joke and to cut up and express our express ourselves as we always do, but we were a little nicer probably under the circumstances than we might be sometimes. And then I know that's the experience that people are having with respect to education as well. So it certainly beats not having any class experience during this time that we're not going to be in school. Yes, sir.
Governor, we're almost halfway through the month. What is your sense? What do you believe the likelihood is that you will allow your order to expire on April 30th?
I'll have an announcement on that when I have an announcement on that, and today is just not the day. What I will tell people is we're in a better place than we were a week ago, and a week ago we didn't anticipate that we would be here necessarily. So can I tell you where we're going to be a week from now? We just have to wait and see, and I'm asking people to be patient. But I will tell you that whenever we start the transition, it is not going to be like flipping a light switch where you go from all one direction and then you start going totally in another. It's going to be a transition period, and it's going to be dependent on a lot of things, including the various types of testing that we just talked about, and loosening restrictions as we are able and feel confident. And by the way, monitoring at all times whether cases spike, and if so, you got to ratchet down again. But we will do this as a team, working with the federal government and the folks at CDC, and working with Dr. Fauci and his group as well. And so we're not going to have an announcement until we have an announcement about that. I will repeat, however, the models that show that the total deaths in the United States related to COVID-19 going down significantly are premised upon us having these mitigation measures in place, not just through the end of April, through the end of May. Now, I'm not making an announcement today, but the people need to know that that's what those models are premised upon. And because sometimes individuals will throw these models up and they don't tell you what's informing them. But those models are informed by an assumption that says that those measures will be in place through the end of May. So we'll see. Yes, sir.
Governor, are you going to do anything with your clemency power, regulatory power, to alleviate the number of prisoners in Louisiana prisons?
First of all, that's already happened to some degree with respect to pretrial detainees, and so you've got sheriffs and DAs working with probation and parole and judges to look at all of those individuals that they think should not be detained, and because they don't pose a threat to public safety, and we're trying not to have more people than is necessary. And then we have an effort underway in the Department of Corrections to work with some authority that the Secretary already has, and we're looking at nonviolent, non-sex offenders within 6 months of their release date, focusing primarily, or I shouldn't say primarily, but first of all on those people who are older, 60 or older, and have underlying health conditions, to see whether they can be furloughed. But if so, it would be they have to have a home. It would be home confinement. They would have an ankle bracelet on, and their case would be approved by 5 of 6 people sitting on a special panel that would look at this. And the panel will be comprised of an individual from the Department of Corrections, the Pardon and Parole Board would have a representative, but you'd also have the Sheriff's Association, the DA's Association, and a victim's rights advocate. And I don't know if I just named 6 people, but there will be 6, 5 of whom would have to vote for that in order for that to happen. So there are some steps that are underway. That process has not yet started. The Department of Corrections is gathering the information on individuals who meet the criteria and gathering the files up so that they can be presented to the panel, and then that will start sometime in the near future.
Any timeline more specific than that?
No. The last that I heard was that the goal was to start it on Tuesday, having the first iteration of that. I don't know whether they have gotten it to the point where they can actually get the first one done Tuesday, but I'll let you know. Yes, sir.
Back to testing. And you mentioned more testing coming online that makes the results come in much faster.
Yeah.
Where are we as far as the lag between someone getting a test and the numbers that are coming out daily, and when can we see that lag close?
It's not an easy question to answer because it depends on who's administering the test and the lab that they're using to get the results from. One of the things that we don't have fielded as robustly now as we would like, and it's just a function of the supply not meeting the demand, are these Abbott machines that can do a test in 15 minutes. It is true that we received our 15 machines, but we also received a total of 120 cartridges. Well, a single cartridge is required for every test. And the cartridges are being produced as quickly as Abbott can produce them, but we can't get any more until we work through FEMA, and we're doing that now to try to get more as they are produced. So we have the machines, but not necessarily the cartridges to make a big difference. But we do have health care providers out there that have been able to obtain their own similar machines. But these are the machines that we really want to have in place all over the state of Louisiana, because you can quickly determine whether someone has it, and if they don't have it, then you don't need to burn all the PPE, and you don't treat them exactly the same way. So it's important to do that. But then you have all sorts of different testing that's going on out there. Some of it is being sponsored by the federal government, and they have contracts with various labs, whether it's Quest or LabCorp. You all know from reporting over the last week or so, and I think things are better now, but at one time the Quest was taking up to 7 days to get the results back. They had a backlog of 160,000. Some of the testing is still going to the state lab, although it's safe to say now, over the last several days, every day we've reported new tests, upwards of 90% of those tests are done by private labs. And so there's more reliance on the private labs, which is important because it helps with your capacity and your throughput, but the reporting is uneven. And so it's really hard for me to tell you. And we're talking to all of these testing entities and asking them to report more timely the results. And we're also asking them to report more information with the results. So that, for example, we don't know currently from private labs the race of the individual whose test results are at issue. We know the race of deaths, and we've been talking about that a lot lately, but we're trying to see whether what percentage of the positive cases, for example, are African American, and then compare that or contrast it to the percentage of deaths from COVID-19 who are African American. Right now, we can't do that with respect to most testing because that information just isn't available. So there's a lot of work on testing that continues to happen. And while we've ramped up testing overall in a way that I think is commendable, because we do have either number 1 or number 2 per capita testing in the country, and we're right there with New York. And one day we're number 1 and they're number 2, and then the next day it's the other way around. But we've got some more work to do, and I don't know if you have anything to add to that.
And on top of that, with the testing and the results and the numbers that we're getting out daily at noon, is there any idea of possibly moving to it being more specific? I know you mentioned the race of people and things like that, but there's one particular parish that is saying when something happens in a particular zip code. Is that a thought process to do that statewide, or is it just so much to try to do?
I don't know whether we've tried to do this by zip code. I can tell you that the more data that you can get, the better. But you can literally sit there and spend all your time doing nothing but manipulating data and looking for new ways to report things. And as for zip code or other things, I'm going to ask Alex to come up and respond to that.
Yeah, I mean, I think we're certainly looking at the data at a parish level. We understand the desire to get more granular. I think we have to balance that as well, especially with our rural parishes, about starting to risk identifiable information. That's something that, again, we want to be very careful about. This is still personal health information, and so when we start to get to details where we've got one case in a parish and we start to give too much demographic information, you can start to identify who that individual is. So we are looking at where we can censor the information below a certain level if it's too low, but where we have places like Orleans and Jefferson and East Baton Rouge, other places where we have large numbers, starting to give that data out. Then the other factor we need to look at is, do we have confidence in the data? And when we're talking about things like demographic data, where we're not getting that from the vast majority of the tests, from commercial tests, we worry about showing you a picture that represents 20% of the tests in that area and people drawing conclusions based on that, when it could just be what's going on in that 20% and the next 80% look very different. So we have to be very careful. We want to give you not only accurate information, we feel confident what we're putting out there is accurate.
All right, you have been listening to efforts on a statewide basis to fight COVID-19. We're going to shift gears and now take you to City Hall, where Mayor LaToya Cantrell is updating the public on efforts to fight COVID-19 in New Orleans.
And representing our New Orleans City Council is our Council President, Helena Moreno. You're going to hear from all of us throughout, and you know how we go, keep it moving, and I'll come back and forth. But where we currently stand right now is 5,242 positive cases in the city of New Orleans, with 224 deaths. I want to thank all of our residents and all of our businesses for just doing their part. Residents staying at home. It's working. The data tells us it's working. This is not the time for us to let up. We need to continue to follow the stay-at-home mandate so that we can continue, one, as we've started to see our curve. And there's been a lot of talk about the curve is flattening. But I want you to know, we see the curve. The stay-at-home mandate is working, but we're not flattening. We're moving in the right direction. And if we continue the course to stay at home, then we know without a doubt we will flatten, we will be a healthier community, and we will move and shift and pivot towards recovery sooner rather than later. But it is all dependent upon you, the residents, who have been listening, and we thank you for that. As we know, this is Passover, it's Holy Thursday, Good Friday tomorrow, Easter Sunday. This is a big, big time in the city of New Orleans for us culturally, even as it relates to celebrating the rebirth and the resurrection of our Lord and Savior, Jesus Christ. But again, we need you to stay at home, follow our mandates because they are working, and do not use this weekend as an opportunity to break the rules. Please do not, because everything that we've gained, all the things in terms of progress could be turned back around very quickly. So the reason we've made these gains is because people are following the rules, they're staying at home. I also want to thank our business community for continuing to provide essential services to our residents. And more importantly, I want to continue to thank our healthcare professionals and our first responders who continue to be on that front line. And it's because of the real care that you're providing that we're seeing our people coming off of ventilators faster. More people are living, but at the same time, our focus has to remain on saving lives. So while we've seen the death rate increase, we're now at 224. With the type of care that our people are giving and the focus that we're providing, we want to see a limit in those deaths moving forward. There's also been a lot of talk locally, but also nationally, as it relates to the impact disproportionately among African Americans in our city, in the state, and really on a national level as it relates to the outcomes and how we've been impacted by this virus. And what it clearly shows and what we're witnessing is the intersection and impact of multiple things, whether it's race, gender, income inequality, the health disparities that we know exist in terms of chronic illness that continues to plague the African American community, making up that large portion of disparities in our city, the environmental, racism that we've seen just countlessly, and also the inefficient health maintenance. And this speaks to our community, to our people, going to the doctor and getting the health care that they need and also that they deserve. But what we're witnessing are all of these things in terms of the intersecting and the impact that it's having on our people due to this virus. It's having a ferocious impact. And so with that, make no mistake about it, the city of New Orleans has been very much focused on the health disparities in our community. And quite frankly, we doubled down on our efforts in that post-Katrina environment, where we have seen more medical clinics in our communities throughout the city, where we've seen more investment as relates to even obesity, that we're seeing chronic illness. It's the reason why we went smoke-free as a community. Again, being focused on the health, outcomes, and disparities of our people so that we can be a healthier community. But at the same time, and as we're experiencing this virus and the impact that it's having on our African American community, we're also being very intentional about going to where our people are as it relates to doing more testing, again, being more intentional about where we go, looking at those disparity gaps as it relates to testing to make sure that we are not missing anyone. But Dr. Vegno, who will follow me, will tell you, we're doing more testing in the city of New Orleans than we're seeing in the United States of America, and we're really continuing to be second to Iceland as it relates to testing. But we need to know the real impact of community spread to ensure that we have a recovery that we can all be proud of. In addition, I just want to touch on this, and I'm going to move on out and bring up Dr. Vegno, and I'll come back. A part of what we have shared over the past couple of weeks has been the financial impact to the city of New Orleans as it relates to our deficit, and looking very closely and monitoring and forecasting every single day as it relates to our income, meaning our cost burden that we're having, and how we need to not only focus on it, but as it relates to having a better understanding of the federal aid that will be coming our way. As we've taken a deeper dive into the CARES Act, we do have some concerns, I have to say. We need to make sure that we keep red tape out of it. Keep it to a bare minimum. We want money, and money needs to move very quickly to places that have been most impacted by this virus. And the city of New Orleans is one, the fourth in the nation where we have seen we're ground zero. Second in deaths per 100,000 people. So with that, we're going to make sure, and we have to make sure, that the city of New Orleans gets her fair share as it relates to the federal flow of dollars from the federal government to the state of Louisiana to the city of New Orleans. And let me tell you, even though we do not hit that 500,000 threshold, right, because that's been the threshold that the federal government is using to determine communities that get their federal dollars directly. Because we don't meet that threshold, we therefore will receive resources being funneled through the state of Louisiana. 29% of the cases in Louisiana and 31% of the fatalities right here. Our losses will be over $150 million and growing. We know that our residents were right at 400,000, a little above 400,000, but we serve, when you think about it, and as you've heard me say this long time, 18 million visitors hit the city of New Orleans as we've experienced every single year. So with that, it just has been an added burden to our population. So we're not just 400,000 the way that we're looking at it. But local governments need to be able to provide essential services, as well as we need direct federal support. So you'll hear more from me on this issue. We're not going to let up. We're going to be relentless in ensuring that the city of New Orleans gets her fair share based on this city being ground zero for this virus. The need is urgent, and the city of New Orleans, let me tell you, we will flatten as it relates to the line, but without immediate assistance and meeting our people where they are, it puts us, the burden back on the city of New Orleans. So with that, I'm going to turn it over to Dr. Jennifer Vegno to speak to you more about where we are and where we're going, and then bring up Colin. We'll hear more from our council member, and I'll be back. So with that, Dr. Vegno.
Thank you, Madam Mayor. Thanks, everybody. I want to reiterate what the mayor's saying and begin by saying we are nowhere near the end of this crisis. That said, we do believe we are beginning to see signs that our stay-at-home order, which has been in place for almost 4 weeks, is working. We're seeing a steady pace of cases, which we believe will tell us that the infection rate is slowing. However, hospitalizations and deaths are still on the rise, and we expect them to increase for some time. Our local hospitals are holding steady, but they are in the fight of their lives. So it is more important now than ever that you continue to stay home. We cannot let our guard down, because that could bring us back to square one very, very quickly. Remember that the stay-at-home order has been extended through at least the end of the month. And while we hope to see new cases slow very soon, some of our neighbors, in terms of parishes and states, are days to weeks behind us. We are going to all be in this for some time. I just want to offer my personal thanks and the thanks of our team to everyone who is truly heeding our warning and staying home. Please be patient. Please keep it up. One thing that has been highlighted in recent days is that this disease is disproportionately affecting our African American community in New Orleans. That's due to many factors: underlying health conditions, access to health care, poverty, racism, and more. And these are factors that we call the social determinants of health. Even before COVID, we've spoken up about the generations of inequities that have plagued our community and about the need for real, lasting structural changes to address this unacceptable reality. So as we close down our federal pilot drive-through testing, which Colin will detail in a moment, we are committed and will continue to ensure that testing is available to the communities that are hardest hit, to our most vulnerable communities and our communities of color. We are actively working with local healthcare institutions to set up mobile testing that will help us bring tests to communities that are being impacted the most by severe illness and death. We will bring it to you. There's going to be more to come on this in the next couple of days. The medical monitoring station at the convention center is up and running. There are several dozen COVID patients now getting 24/7 care as they recover. Again, this is a facility that's designed to take the strain off of hospital resources and serve as a step-down care center for non-fragile patients. The state very rapidly has expanded its criteria even further to accept patients referred by physicians and from other regions of the state in addition to local hospitals. So what that means is that if you're COVID positive and stable, but you're worried about infecting your family members, you can talk to your doctor about whether going to recuperate at the medical monitoring station at the convention center is a good idea for you. If you've seen the video and the pictures of it, it is an incredibly impressive facility. It is really probably the best facility. If you look at the other ones that have been stood up around the country, this is absolutely the best. It's got private rooms, private bathrooms, 24/7 bedside care, 3 meals a day, and a safe place to be monitored and to recuperate. I'm also excited to announce a new initiative today called SODAT NOLA, and SO is S-E-W, like sewing with thread. As we said last week, we encourage residents and our essential workers in places like grocery stores, pharmacies, banks, everything that has to be open in order for us to continue. We recommended that everyone should wear face coverings while doing their essential activities, whether they're shopping or working. Our cultural community, in partnership with City Council and private industry, has launched SODAT NOLA. SODAT will collect homemade face coverings from donors and match them with requests from our essential workers. This helps ensure that these essential workers are protected while they do the work that helps keep the rest of us safe during this crisis. Again, this is not our healthcare worker community. These are face coverings for everyone else who is ensuring that we have what we need to survive. So if you're a sewer and you'd like to contribute, or if you're an essential worker and would like to request face coverings, go to SODAT.com, SEWDAT.com. The website's up and running. The program should be ready to take donations and connect with workers early next week. If you can afford to buy face coverings for yourself, if you're a member of the general public, and you want to support our local economy at this critical time, there's going to be some really great options out there, handmade by our Mardi Gras Indians, artists, and other culture bearers. We really have the most creative community in the world. We invented face coverings, and they're stepping up now with crafts that make a difference. So we thank them, and we thank you for continuing to abide by the stay-at-home guidance. Thank you.
Thank you, Dr. Vegno, and we'll keep the updates coming. Now we'll hear from our Director of Homeland Security, Colin Arnold. He and his team they've just been doing a phenomenal job of managing us through this crisis, standing up our warehouse at the Smoothie King Center. That's very effective, and I cannot say enough about Colin and his leadership. So, Colin.
Afternoon, everybody. So today we're announcing that the drive-through testing program in Orleans Parish will end after a last full day of testing tomorrow. I am really proud that New Orleans was able to be one of a handful of cities that ran this federally supported pilot program, also with our partners at the state of Louisiana and the Louisiana National Guard in particular, and Air National Guard. Through the program, we've tested about 13,000 people in the region, which greatly contributed to the fact that we have about the highest amount of COVID testing per capita in the country. 6% of New Orleanians have been tested for COVID, and that's an astounding number. This program allowed us to offer easy and accessible options for our residents to get tested, while also taking the strain off of hospitals and clinics during the critical early days of the pandemic. We've agreed with our partners at the state that drive-through testing program will now move to other parishes, our neighbors and friends, to ramp up their testing. I want to be clear, though, there's still plenty of options for Orleans residents to access free testing moving forward. In Jefferson Parish, the Ilario Center is going to remain open and for all metro area residents to be tested in that drive-through program. And there are numerous other clinics and facilities in the city that continue to offer COVID-19 testing. And we're working with the healthcare industry through our health department and Dr. Avegno to set up mobile testing programs to bring them to communities in need. During the last few weeks, we've heard from many businesses asking to be allowed to reopen. I want to take this opportunity to reiterate what you've heard already and remind everyone that we are under a stay-at-home order at least through the end of this month. And if your business is not essential, you need to remain closed. I'll reiterate again the importance of staying home right now. This weekend will be interesting. It's usually a very celebratory time in our city, but Easter has to be different this year. Please do not host family gatherings, picnics, or Easter egg hunts. It's just too dangerous to risk a spike in infections right now when we're doing well. New Orleans Police Department will enforce stay home and the stay home order and bans on gatherings. You can call 311 to report illegal gatherings. We've already lost over 200 people in our community. These are our friends, they're our neighbors, they're our loved ones. We have to continue to do this and stay strong. There's been some optimistic talk lately, and we're a nation and a city of optimists, but it's time to be realistic. We're in this at least through the end of the month, and we have to continue that. And I'm begging the public to do that. The sacrifices you make today and the sacrifices you make this weekend and in the coming weeks will save lives. Thank you.
Listen, I know we've kind of grown to be a people or a community of wanting instant gratification. And during this time, it's something that it's a big sacrifice that we're all making, but it's worth it because you all are worth it. It has been just an honor to work with the New Orleans City Council through this crisis, who have been partners with the administration as we work through our cash flow issues, our budget issues, deficits coming forward, and even as we pivot to recovery. I just want to thank the leadership of the New Orleans City Council, and I'll ask our Council President, Helena Moreno, to come forth at this time. Councilwoman?
Thank you, ma'am. Well, on behalf of the New Orleans City Council, we very much thank you, Mayor, and your entire team for the tremendous leadership that you have been showing throughout this very difficult crisis. And while it is true that we do have some tough times ahead, particularly with the city budget and our overall recovery, we are all in this together, and the City Council stands firmly ready to assist you. That's right. The City Council also, of course, very much wants to thank those essential workers, those healthcare workers. To the healthcare workers out there, yes, you are absolutely saving lives, but let me just also explain a little bit more about how your bedside manner at the end of the day is making such a difference. Not only here in New Orleans, but really across the state of Louisiana. My friend, State Representative Ted James, who I served with in the legislature, he became very ill with COVID-19 and ended up at the hospital in Baton Rouge. He had gotten to the point in his illness where he felt that he no longer had any fight in him. And we all have to remember that at this time, there are no visitors allowed in hospitals. So that loved one that ordinarily would be able to give you that support isn't there. But it was the nurses who encouraged him to keep pushing and to keep fighting. And he says it is because of their encouragement and support that he is alive today.
So that is how important the work that you're doing is. So we will forever be grateful for the work that you're doing during this crisis, the nurses and all of the healthcare workers. We, the council, also want to thank the essential workers who are helping to keep services running in our city, from our banks to our grocery stores. Thank you so much, especially to our grocery stores. We know that demand is high, and our pharmacies as well. And so we know that this has been difficult for you, but we truly thank you for all that you're doing. And finally, of course, we want to thank the people of New Orleans for doing the right thing, for taking the precautions, for staying home, because it is making a difference. But as you've heard, we still have to continue to keep our foot on the gas. This is not the time to ease up. Let's face it, we all know people who have become very ill with COVID-19, and unfortunately, many of us also know people who have lost their lives to this virus. This virus is a killer, and the only way that we're going to be able to continue to save lives is if people continue to stay home. So for those of you who may be at this time, maybe somewhat considering maybe having some type of gathering, whether it's for Passover or for Easter, I want you to think about this. Think about the fact that maybe if you have this gathering, someone who shows up ends up getting you or others in your family very sick with COVID-19. Think about the fact that maybe if you have this gathering, that someone who ends up at your gathering catches COVID-19 and then ends up losing their life. It is just not worth it. Please, please continue to stay home. Today, I also want to go ahead and give an update on what's happening with the New Orleans City Council. Of course, we're also continuing our social distancing measures. So the council meeting has now put in place a process for upcoming council meetings, and those meetings will be online. So these are going to be virtual council meetings. The next regular council meeting will be held Wednesday, April 15th at 10 in the morning. Once again, this is an online meeting. The council chamber will be closed to the public. So here's how it's going to work. So myself as council president will be in council chambers working from my iPad, and I'll be joined by the clerk of the council and also the council chief of staff. Those will be the only people in the council chamber. The other council members, they will be working remotely also on whatever electronic device, either from their offices on the second floor or they'll be working from home. So I want to make sure, though, that even though that the chamber is closed, we still will be allowing for public comment. So the form to submit public comment, that can be found on our website. Our website is council.nola.gov, and the agenda can also be found on our website. That agenda will be posted today. I also want to make very clear that all of these processes were developed in accordance with an Attorney General opinion, which he put out on March 18th, as to how public bodies are to proceed with public meetings during this COVID-19 emergency. The meeting can be seen live on our website. Once again, our website is council.nola.gov, and also on Cox Cable Channel 6 in Orleans Parish. So once again, I just want to make sure everyone understands that we will be accepting public comment on what is on our agenda, which will be released today, and all the forms can be found on council.nola.gov. So the New Orleans City Council, of course, is committed to keeping government running, but we want to do it safely, and we want to continue to encourage everyone to stay at home. Thank you so much.
Thank you, Councilwoman Moreno. One thing about it, as she mentioned, city government is still running and operating. And going to having meetings remotely it's the new normal. And it is imperative so that we can keep the business going. We have recently stood up meetings. The Architectural Review Committee recently met. So we're moving those along through VCC, HDLC, and the like. Also, we are having our public engagement, our community engagement meetings as it relates to infrastructure projects that we are moving forward with in the city of New Orleans. Last night, I think we had St. Claude. We had a community meeting via WebEx. We had over 40 participants, which was a big deal because in a usual setting in the neighborhood, we may get about 7 to 8, depending on the matter. But An increase of 40 is a big deal, so we're just seeing, in terms of engagement, that's happening, and it will continue to be a top priority for us. I've instructed my staff to now have all these groundbreakings and even some ribbon cuttings that have been piling up. And I said to them, look, let's do them virtually, because we need to show the people that we're doing what we say and we're getting your business done. So with that, we're going to move to questions and answers at this time.
I have two questions. The one is, we receive a lot of complaints about churches in New Orleans East. Pastors calling people, members, for weekend services. Mm-hmm. They say it's only 10 or 12 people. We say they can do that, but it's still working.
We say no.
Okay.
We say no, meaning the city of New Orleans and all of our officials, our public safety team, from chief of police, fire, EMS, Homeland Security, Dr. Vegno, our city council officials, mayor of the city of New Orleans. It's not tolerated, unfortunately. And we understand that this is a huge sacrifice, but it will be a sacrifice worth it for everybody. And that's a part of why we touched it in this press conference, kind of holding it until Thursday, today, to speak towards the upcoming weekend. But we cannot support this type of activity, and we apologize, but it cannot happen.
I have second question for Dr. Begno. People need to know exactly when people with COVID-19, it's okay, it's free, it's healthy, because it's many confusion about that, because some people they don't have the symptoms like respiration or fever or something like that. They need to know exactly how they can determine when they are free.
Sure, and we'll have Dr. Vegno speak on that. And what we have seen, even as it relates to, our department's public safety team, for example, where we've had, officers that have COVID or have been on quarantine that have now returned back, over 56 of them, also with fire. So we understand not only the question, but how it can be confusing. So Dr. Vegno?
Yes, thank you. It is confusing, and the guidance has changed in the few weeks that we've been doing this. But what we're putting out, and again, this is based on CDC guidance, and we're doing this with all the best practice that we can. If you have tested positive, if you know you have a positive COVID test, the recommendation is you have to stay home for at least a week, and you have to be at least 3 days with no symptoms. So you're feeling 100% back to normal, no fever, no cough, no anything else. If you're someone who sort of felt bad but didn't get a test, you should assume that you had it. And in that case, we're saying 2 weeks since your symptoms first started, since we don't know, whether you were positive or not, but the day your symptoms, whatever your symptoms were, if they were cough, if they were fever, if they were fatigue, feeling, that you couldn't smell, then we're saying wait 2 weeks. As long as you are back to normal, you can do your, again, still stay home, but do your essential activities. We are strongly discouraging employers from asking employees to provide proof of a test or a return to work note. We do not recommend that. That is an overburdening of our healthcare system. It's not necessary for individuals. Again, this is based on federal guidance. So again, just employers, it is not necessary for folks to disclose to you their test results or provide a note to return to work.
And Dr. Vegno, talk just a little about our efforts preparing for antibody testing.
Sure. So you probably heard that there are tests that can determine whether you have antibodies to COVID. So the test we have now just shows if you are infected at that time. What an antibody test shows is if you've had the disease, it will remain in your system forever. And this is, the basis of a lot of our of tests for other diseases. So if you were sick, you're feeling well now, and you had an antibody test that could say, yes, you've had COVID, but you're back to normal, so you are likely immune. This test, we believe, across the world is going to be really important to help us understand who is safe to go back to work when we begin to talk about a phased recovery. To my knowledge, there are 1 or 2 of these tests that just received FDA approval this week, which means that no one has them, and they're everybody wants them. I've had multiple discussions with the state and with our local healthcare institutions. They are all either in discussions about which test might be the right one, how to deploy them, whether or not, I'm told there are some researchers at LSU who might be working on one themselves. So we are tracking this very closely. Councilmember Moreno also has been very interested in looking into this. These will be a part of our recovery, but we also want to make sure that they are reliable and that we can rapidly deploy them to those who need them first.
Oh, we got CNN around here.
Hey, Mayor. We're wondering if you've received any refrigeration units from the state, and if so, how many?
Yes. We made the request to the federal government through the state of Louisiana. We made a request for 20 with the expectation of morgue space being needed for our neighboring parishes, particularly those that make up Region 1. We have stored the refrigerators at Nassamishu temporarily, and we have actually shifted into creating a temporary morgue adjacent to our coroner's office here in New Orleans off of Earhart. We're working with an adjacent owner there who is providing space on his property for the refrigerators to set up, again, a temporary morgue. We are also working with that owner to erect privacy fencing so that we can be, of course, as respectful, as needed when it comes to caring for the dead. We have shifted to working with our surrounding one of the hospitals and different mortuaries that hold death care task force that I stood up several weeks ago, working with them to allow the coroner's office to kind of alleviate the burden that they're experiencing because of a lack of capacity. So that's happening, and I'll ask Colin to come up and just share a little bit more with you, because he's been front and center on this for the administration through Homeland Security. Colin?
So the mayor pretty much covered it, but I'll just fill in some details, because this is real and it needs to be out there, and it's going to be a reality that we're going to face. We requested through the state for 20 refrigerated trucks. 10 of those are now currently on site next to the Orleans Parish Coroner's Office. The Coroner's Office itself has 2 trucks, and the city rented an additional 2 right in the beginning stages of this. So that's a total of 14 refrigerated trailers that are on that site. We have erected privacy barrier around that area. We have also light towers and cameras there. We're working with the state, and they are, through the Department of Health, identifying the assets and resources needed to run that facility, and that will be done through the weekend. Additionally, we have staged 10 trucks in New Orleans East. Those can be dual purpose, either a backup facility, should it be needed, or working with the state and our regional partners. And I have to say, the Orleans Parish Coroner's Office, we've been working with them obviously very closely, but also Jefferson Parish. Dr. Satanovich learned far more about this than I ever thought I would. It's a reality. We've been through it before, and there were some serious lessons learned from that, which I believe will put us in a better place this time dealing with this. And it's not the same circumstance as Katrina. This is an issue of a lack of storage capacity under very unique circumstances. Those additional 10 trucks that are out in New Orleans East, we will maintain them. They will be able to be moved or staged with other coroner's offices, potentially medical facilities if needed, or anyone in the region or state as far as we know right now. So it's really a partnership between the local coroner's offices, the death care community, the hospitals, and the state of Louisiana in particular. Has been, real. As soon as we started requesting this, they were on it, and that's what I'll say about it. And I would ask that you'll see the activity around the coroner's office. I would ask people to respect the dignity and privacy of the people that are, in a very difficult time.
And just to clarify, yes, when we said New Orleans East, it's at our training academy that we have there for the New Orleans Police Department. And again, they're staged there. So with that, next question.
I wonder if y'all can provide more information about how the mobile testing will work, and was the end of the drive-through testing solely because of the end of the federal resources, or were there other factors involved there?
Yeah, most in regards to the drive-up testing is that we had reached pretty much, we weren't getting, the population, the numbers, they were just diminishing. When we first started, we were, cranking out up to 300 at each site. Then we went down to one site and we're at 50. We're seeing like 50 people. And so we want to pivot our outreach to be more intentional about, again, meeting people where they are, looking at more closely in terms of hot spots that we may have identified, where we want to go where people are. The federal government considered our testing sites, our pilot being one of the best that they deployed nationally. We were the first to stand it up. It took us 3 days to do that. And they had actually made an additional commitment to provide us with additional testing kits to continue to run that operation. I'll ask for Dr. Vegno. You can speak more about the drive-through, not the drive-through. What did he say? Mobile.
And I just want to be clear that several of the federal pilot sites are also ramping down. Philadelphia is doing it as well, and several others. We were told by the federal government that April 10th was the day that they were going to remove their presence, and so they asked us all for a transition plan. And as the mayor said, we really do want to get kits and tests efficiently into the hands of where they are most needed. While we consider the drive-thrus to be an incredible success. I think you've all heard me talk about our frustrations with the commercial lab and the length of time that it's taken for folks to get results. And so we have some better options now that we'd rather support. In terms of the mobile testing, I don't have specifics for you. There's, again, healthcare institutions have few different ways that we're looking at doing this. So I don't want to give you too much, but what I will say is that looking at our drive-through testing data, we've been able to see those areas where very few people have come and got a drive-through test. So what that tells us is they either don't have transportation, or it wasn't convenient, or there's something missing there, and they're not able to access that service. So we're in the process right now of identifying those bare spots, B-A-R-E, and saying we need to find a way to be in this neighborhood and get tests to these residents because they weren't able to access the program that we had. And so I'm hoping early next week, middle of next week, we'll have a lot more details on what that would look like.
Dr. Vegno, you want to share information of our testing for first responders, health workers through Oshner?
Yeah, Oshner reached out to us earlier this week or before and offered to provide some rapid testing for our first responders. I know Tulane had done that as well. And so starting today or yesterday, we've been able to identify first responders who are symptomatic, who are able to access one of the Oshner testing sites and get a turnaround within 24 hours. This is huge because, as you've heard, we've had a lot of our first responders become exposed or symptomatic, and it's taken a long time for them to get their results. And so the ability to get them back, get them the peace of mind, number one, get them back to work much more quickly has been great. So that's just another example of how our healthcare institutions are really stepping up and being flexible and responding to the needs of the city.
Two questions, Madam Mayor. Last night, police responded in Bayou St. John to people gathered along the bayou, and even across the street there's a police presence as people are kind of gathered in the park. You know, we're going into a holiday weekend. It's beautiful outside. Does the city plan to continue stepping up law enforcement?
Oh, absolutely. Oh, yeah. We're not letting up because it's not a time. We cannot let up. The future of our people depends upon it. And so we will be absolutely, remaining aggressive as it relates to enforcement, constitutional policing practices all the time, EPIC, that's ethical policing, So we will be doing that, but we will be aggressive. And it's important. But what we do find, and this is the beauty in this, when the police do have to respond, and we have seen numbers kind of going down, meaning in the amount of calls that we are receiving through 311 about these gatherings. So we're seeing a decline in the calls, which is a good thing. But when the police have to respond, and they do, we see that they are met not with frustration. People disband accordingly, and that's the best thing that we hope for. One, we hope that you just do the right thing and take the burden off of our police department to have to respond, to gatherings. But when they do, how you meet them with respect, it does matter. And that's what we've been seeing. But let me tell you, you're making me think about something that one of our students, I believe, at Tulane experienced on yesterday. And you guys can get me straight on this. But discrimination is something we will not tolerate in the city of New Orleans. We are a welcoming community, always have been, always will be. And we had one of our Asian residents approached with a gun, and someone asking him if he was Chinese or Vietnamese. That's unacceptable. He's a human being. And this virus doesn't discriminate. And the city of New Orleans will not at all, and we will not tolerate that. I just had to touch that. And then let me add this, and this is I was on a little call earlier with Barack Obama and, and some of the messages that he was sharing. And one was that take care of your most vulnerable people. You will not go wrong. And even as it relates to health disparities and the impact on the African American community, going even a little bit further as it talks about our vulnerable population, that's our street homeless as well. So what we will not also tolerate in the city of New Orleans is the thought of not in my backyard. These are all of our people, and we will take care of our people and our most vulnerable. So I was proud to hear him say that because it just reinforced for me that we're doing the right thing as a city. And I had to field some calls by some residents kind of upset that our homeless are near them. But they are our people, and we have them located in the CBD, in Algiers, and in New Orleans East. Everyone matters, and we will protect all of our folks the best that we can, and that's why I'm focusing on now I believe about 147 it shifts as it relates to that number of our people who are still on the street. And that remains a priority for me and my administration to get them off of the street. And so thank you for your question. LaToya?
Sorry, one last question.
I'm sorry.
No,
I
it's okay.
went all around the world.
There's been complaints about people discarding gloves and other sanitation equipment around the city, especially in grocery store parking lots. Has there been any talk about that sort of careless disposal?
You meaning discarding, throwing away? well, first of all, we need to use our protective equipment and be responsible with its use. There's a lot of effort that has gone out to get our hands on PPE, whether that's effort, of course, from the administration, from the New Orleans City Council, our partners that we've seen from across the country. We have to be responsible and show that we're appreciative of the PPE because it is being provided to protect everyone. So if you have it, use it, and use it the right way. But no one, I don't care if it's PPE or what, no one should be littering the streets of the city of New Orleans. Now, I don't know about you, but I've seen things a little bit cleaner. The administration was still hard at work. Fewer people on the street. But when I still see trash on the street, I'm like, come on, people. We can do better. We can do better. So please do not litter the city that you love. And this is a real opportunity to not only clean our city up, but as we pivot and move towards recovery, that we come out of it with a cleaner city that we will keep clean. That's my goal.
I got three. The first one, yeah, I'll make it quick.
Making me feel like the governor around here, all these questions.
In regards to the Carnival cruise ship, the governor said yesterday that 300 of the crew members were released yesterday. Do we know how many are still on the cruise ship?
On the cruise ship right now, I know that those individuals who tested positive remain on the ship, on Valor. I do not know the exact number. I'm going to point to Colin to see if we have that exact number of who currently remains on the ship. Colin, you know?
Approximately 200 remain on the ship. 124 tested positive but are asymptomatic at this point. 12 have flu-like symptoms.
And are you still experiencing a major backlog on test results?
We are. We have seen more come in, and that contributes to the number of increase in the results in terms of positive. We do feel like we know we still have a backlog, but Dr. Vegno, do you know that exact number now?
As of yesterday, I would estimate it to be about 1,500 results that we would expect to have by now, but don't. I know that there's more results that came in this morning that I haven't run the numbers yet. With closing the site tomorrow, it's my hope that backlog will be relieved by next week.
Last one. Once this pandemic is over, or at least gets better enough for the city to start functioning again, what's the first step in attacking the $150 million in fiscal losses?
Oh, we're working on attacking that right now. That's why we're very much focused on it as a city, and I do believe one of the first cities in the country to take a real deeper dive into the CARES Act and determining what it really will mean to the city. As we have taken that closer look, we see that it will not, based on how it reads and how in our discussions at the state level, which will be ongoing, but based on the formula, that it will not cover the deficits that we have. And that's a big concern. It is, what we're told is that it will be based on the expenditures or the expenses that are aligned with COVID, and not so much the losses, right, to businesses, the losses to the city of New Orleans due to sales tax and the like. And so that's a major concern for the city at this time. If, we can't feel that, at least, that 150 and upward deficit that we're seeing, and most of that, in an upward of 120 million, is really sales tax related. That's a big hit for the city of New Orleans, and it doesn't make me feel like we're cared about if that's all that's going to come from the federal government to the state of Louisiana and down to the city of New Orleans. but we are looking very closely at it, and we'll be advocating at every single level to ensure that the city of New Orleans gets her fair share, particularly, again, being ground zero for this virus and the financial impacts that it's having on our city.
Sewage and Water Board Director Ghassan Korban said today he sees possible bankruptcy for the Sewage and Water Board as a result of this. Do you see that
potentially
might be the case?
Potentially, and that speaks to really what the point I just made, to that formula, that's been talked about, that will not be included in any type of stimulus relief on the ground to the city of New Orleans, which is a major concern. And you know how critical the services are as it relates to the Sewage and Water Board. And in 53 days, we're going to be in hurricane season, right? So those are things that we're thinking about and have been thinking about, but also not only in preparation for hurricane season, but with this high river, that we have as well. But there's more to come on that, but understand we are very much focused on the impacts that it will have to the Sewage and Water Board and to the city of New Orleans.
Also, we're hearing some reports about churches doing drive-through services this weekend. Any thoughts on that?
We do not support drive-through services or communion. Again, we understand the sacrifice. The Lord understands as well, and we have to do the right thing, stay the course, so that we don't have to worry about drive-through communion.
Also, just generally, it's been a month since the first case in Louisiana was reported. Just what are your thoughts about how fast things have changed?
Well, one of the things when we look at that March 9th date and looking at the data and doing the analysis of the data from March 9th to today, what it says is that based on the actions that the city of New Orleans that we took on that date proved to be the most effective, to where the city of New Orleans not only did the right thing, but we brought the state of Louisiana right along with us in doing the right thing. So we made the right call. And as we look at the data sets, we save lives as well. And there's no doubt about it. So we'll continue on this path, and that's why we're encouraging and really with all of our force, with all of our might, encouraging our people to continue to stay at home. All right, y'all warm me out now. Well, thank you all so much, for what you do on a daily basis and informing the public and being responsible in your reporting. We appreciate that. Thank you.
All right, Mayor LaToya Cantrell updating the city's efforts to fight COVID-19. There have been 5,242 cases confirmed in New Orleans with 224 deaths, but there have been positive trends leading the mayor to say, stay at home. It is working. The data tells us it's working, but it is not the time to let up. She said, we are not flattening the curve yet, but we are moving in the right direction. It is dependent upon you, the public, in continuing to employ those mitigation efforts. And she said, we don't want to use the weekend as an opportunity to break the rules. And that is something that Colin Arnold with Homeland Security echoed, saying Easter has to be different this year. Passover must be different. He said, don't host family gatherings, picnics, or Easter egg hunts. We cannot afford a spike in the numbers. And you heard the mayor just personally say that she does not support even drive-through communion services. Also, you heard the health director, Jennifer Avegno, say we are nowhere near the end of this crisis, but mitigation efforts are working, so keep it up. And then she talked about an interesting Naturally New Orleans effort to help those in the essential working industry, SODAT NOLA, so as an SEW. She said, as you know, you are encouraged to wear a mask in public, so what they are asking are sewers out there who will collect these homemade masks and then give them to essential workers. And so if you are interested in either volunteering to sew or you are an essential worker who needs a mask, go to sodatnola.com. And it is now 4:05. At some point during this hour, we expect an update from the White House, and we will bring that to you live as well.
really impacted my family. My parents were a wreck. They were so worried. My whole extended family was constantly texting me, making sure I was okay. If I fell asleep for 3 hours, I would wake up to 30 missed texts from my parents, because I think that they were all scared for my life. And I think at this point, it's just ignorant to joke about having coronavirus. We don't have the medical resources. We don't have the time to hear fake stories. We need to hear stories from real people who have gone through this experience, and try to keep our hopes up and hope it doesn't spread even more than it already has.
You said at one point you were so sick you thought you were going to die. It was just that bad. You've never been this sick before.
Yeah, I had never been that sick before, and I hope I'm never that sick again. I wouldn't wish it on my worst enemy. I was texting my friends, telling them, like, hey, what do you think? Like, I honestly think I'm not going to make it. This is what the